EMDR stands for eye movement, desensitization, and reprocessing. Our brain has a natural processing system. It knows what we need to remember for learning, for long-term memory, and what we need to release, because we see a lot of things and experience a lot of things throughout the day. And if our brain remembered all of it, it would be simply too much information. However, when we go through something extremely stressful or traumatic, that processing system tends to keep more than what it needs. So what EMDR does is it uses bilateral stimulation, either through eye movements or tapping, to turn on that processing system again. That way we can take negative memories and negative beliefs, reprocess them, and disconnect the big emotion attached to the memory, move the memory to the long-term memory part of the brain. Sometimes when we experience challenging things, our nervous system can be conditioned to react now as if it's still happening. EMDR helps take us out of that survival mode. What happens after EMDR is you still have that memory, you still remember what happened, but when something reminds you about it, you're no longer experiencing that emotional charge. EMDR itself is a structured therapy, so we always start with some sort of safety building, resourcing, making sure that you're going into this therapy with the correct coping skills and resources that you need. A lot of people also say that they have some things that happened to them in the past, but they don't necessarily remember what happened, and that's totally fine. EMDR gives us a structured, guided way where your therapist will guide you into identifying which memories need to be processed. So there's nothing that you need to do to prepare for that. At Evolve Therapy and Counseling, we use a structured therapy method called the Sovereign Body Method. Before jumping straight into EMDR, there are 2 phases that come before that, and those phases are necessary for safety. Within phase 1 of this method, we work on regulating your nervous system so that you can access safety in the body, so that you can feel more grounded, more relaxed, more confident. We're pretty much showing your nervous system evidence of safety, especially if it hasn't had much evidence in the past. When doing EMDR, a lot of emotions can also come up, and your therapist might even ask you what you're feeling. That's why with the Sovereign Body Method, we also go through phase 2 before going into EMDR. Phase 2 consists of, once you have that safety in the body, of feeling your emotions and letting them go through gentle body-based movements. We want to make sure that your emotions aren't stored in the body. We always hear that you need to sit with your emotions, but you actually need to sit with them only long enough to understand the information that they're giving you and then be able to move them through, to let those feelings go. Going through these first 2 phases before jumping into EMDR provides more safety and more clarity. EMDR is good for people who have had traumatic history, anxiety, panic attacks, or are noticing similar relationship patterns that are not working for them. So if you're interested in learning more about EMDR or how the Sovereign Body Method could work for you in your life, schedule a free consultation and we can discuss if it's a good fit for you.